Hi everyone, so MOH has just announced in Singapore that the Pfizer vaccine has been approved for 5 to 11 year olds. This is something that a lot of parents are very happy about, but also a lot of us are anxious about the vaccine in this age group. So in this video, I'm going to give you the top 5 facts that you need to know before you go ahead and get your child vaccinated. So the first one is the vaccine safe? Well, they looked at data from 3 key studies, which included kids from the US, Europe, South Africa, South America, and there is a study going on in Singapore as well. And all of these studies show that the vaccine is completely safe in this age group. We also know that over 5 million kids now have had the vaccine in the US and no significant adverse effects have been reported. 2. How effective is the COVID vaccine? Well, the studies show us that the COVID vaccine is extremely effective in the 5 to 11 year old age group. It reduces the risk of significant disease by 90%. 3. So how will the vaccine be given? So for this age group, the vaccine will be given in 2 doses. It is a Pfizer vaccine, so it is an mRNA vaccine. And the 2 doses will have to be at least 21 days apart. Singapore will be announcing this very soon and your child will be invited to have the vaccine. Is the vaccine dose going to be the same as the adult dose? Actually, the vaccine dose for the 5 to 11 year old age group is 1/3 of the dose of the adolescents and adults vaccines. So for the older age groups, we were using 30 micrograms per vaccine, but for the 5 to 11 year old age group, we're using 10 micrograms, which is 1/3 of the dose for each of the 2 vaccines. Studies show that this dose is effective at reducing the risk of severe disease with COVID. And the final one is, what side effects can I expect my child to get? So the side effects that we saw in the studies and also that have been reported in the 5 million kids that have had it in the US are the same sort of side effects that we see with all vaccines. So a little bit of redness, a little bit of tiredness, chills, mild fever, but nothing significant. And actually, quite interestingly, we saw that these side effects were much milder and reported less in this age group than what we saw with the adolescents. So far, we have not seen any cases of myocarditis, but of course, as the vaccine gets rolled out and more children take the vaccine, then we may see increased numbers. But everyone is aware about the risk of myocarditis and they will be looking out for this. I would like to point out that the risk of getting myocarditis is much higher with COVID infection than it is with the vaccine. Just a quick note about the Omicron variant that we're seeing. I know that loads of parents have been anxious and we've been hearing things about whether the vaccines are still effective against the new variants. Should we be more worried? Well, at the moment, we don't have this information. Time will tell. But it is likely that as we see more and more mutations, the vaccines may become less effective. So it is important that we get as many people vaccinated as soon as possible so we can start reducing the risk of having more serious variants. If you have any more questions, please do comment or do put them on this post and I will get back to you.